Okay, so we will get started. It is 12:01 and I will adjourn the meeting. First thing that we are going to talk about that I wanted to share was how our counselors just recently pushed out some really great lessons to all of their staff and kids at their school that was from the Sandy promise during February. That was Kindness Month. We had talked about on our last Shack meeting that was going to be rolling out. And we had lots of people reach back out and say that it was really good and effective. Lots of good conversations were had from that. And so it's a great resource that we have now that we can use in addition to the other curriculum that they use to ensure that kindness and anti-bullying and anti-suicide and all the things are covered really well. This Sandy Hook Promise program can be found on the Texas School Safety website. So we were very thankful to be able to have that and use in our schools. So there's that little update. Next update I wanted to give was we had the speaker, Sherry Levery, come to speak to our counselors and our LSSPs, and lots of administration came about the crisis management. She's been doing this presentation for over 40 years and has a lot of experience with different crises that she's had to deal with, and Uvalde and suicides by students. And what else did we talk about? Death of teachers and house fires, families passing in house fires and what to do in those crises, how to handle it, who's the first contact and what do we do first. And she came for a full day conference and it was completely amazing. I was thrilled. I did not know her personally. I had read lots of reviews on her and they were excellent. I had talked to her multiple times over the last year on the phone. But I will tell you that it was really, really, really good. She helped look at our crisis management plan that I've been looking at working on for a year. I sent that to her. She gave me some good advice on things that she would tweak or change the wording on or add to. And so that was very helpful. And so that crisis management plan that we have for Granbury ISD, I have completed. And the principals will be receiving a copy of that. It's an internal house copy. And then the administration also will be receiving a copy of it. So we will have that in case of a crisis event. So that was very helpful. And we were glad to have Sherry come and meet with us. We've been working on getting EpiPens for our schools. Have been talking to EpiPens for schools for over a year also, and they donate them for free to Texas schools, and were more than willing. I've been working with Dr. Watts to get those approved and make sure that she will sign off on standing orders. You can see Lauren Bruner is holding those up. Lauren, you want to tell us a little bit about those and how they work?
Hang on. Sorry, I apologize if I have to go back and forth with my video. I get kids coming in and out as the day goes on. So I'm excited that this is something, I've been with the district now 10 years, and we've been talking about this literally for 10 years of getting EpiPens on school. So I'm really excited about having this as an opportunity. So a lot of times EpiPens, as we heard in the news for years, have gone super expensive. Kids couldn't get them. And so now that we have these on campus, what we have them for is for kids that are having severe allergic reactions, which could be, from if they took a new medication or food allergies, or an insect sting. We have a lot of kids that are, sensitive to bee stings. So if any kid has any type of anaphylactic reaction here at school, we now have these available to administer in those emergency situations, which would hold us, for about 20 minutes until EMS could arrive to provide further care. And it really is life-saving. And I'm excited to have these here, and we're working on getting all the protocols and everything in place for the school district to have with these with our nurses.
Thank you. Yes, the admin regulations are in accordance with the Senate Bill 66, have how to treat that. And so we have I'm working on I'm sorry, I don't have it online to share my screen, but we are working on procedures and getting signed doctor's orders. We have them, but we are going to get them for all of our nurses to have posted in their clinics and to have all of the procedures. Also, all of the staff has been trained. We did a training video, and each principal did the training with their staff during staff meetings and have signed off on that. So all staff is trained on how to use the EpiPens for emergencies if one arrives with that. So that's been very exciting to finally get all of our EpiPens in. Next is April 1st. Coming up is our kindergarten roundup. And so our incredible nurses are going to be on hand at all of the elementary schools, welcoming all of those little babies coming into our schools and making sure that they are in compliance with the Texas vaccine laws and have all of their shots needed or a waiver needed before they start school. So hopefully when the next school year rolls around, we will have as many as possible compliant so that it's not a stressful situation on our nurses. This past year, trying to get students in compliance within the first 30 days of school is very, very difficult because, of course, they still have the sick kids who need, their temperature checked, and they need Band-Aids and cough drops and crackers and all the things they come to the nurses for. So we're working really hard to get as many students in compliance or with a waiver before school starts next year. So April 1st, that's coming, and I have 2 shot clinics available. Dishes here in Granbury are ready and prepared, and they have stocked up on the kindergarten vaccines. And also Parker County is coming, and they are going to be at the admin building offering shots for any kindergarten parents who need them as well. They're really focusing on the incoming kindergarten students because it's a lot of vaccines to transport. So some people have asked if, their older kids can get the vaccines also. If they have it, they can, but it's just a little bit too much to transport to the administration building. So it may be a little more focused for kindergarten on that shot clinic. We are still waiting to see when the 6th grade physicals are going to be put in place. And once I have a date on 6th grade physicals, we are also going to be doing the same thing, setting up shot clinics so that those incoming 7th graders can also be in compliance because they are recently added the 2 new shots that are required. So we're going to work on them. Amy is joining us. So Amy, if you want to give us an update on food and nutrition and all the great things that you do, that would be wonderful. You're muted. Okay, there.
Good afternoon. For those of you that don't know me, I'm Amy Whiteley. I'm the Child Nutrition Director, and I'm hoping I can share my screen. If I can, I'll just walk you guys through some of this information. Can you see that? Are you able to see my screen?
I can't see your screen, and sometimes it goes to Kim Spencer's. Let me see. Okay, try that.
Let's see. Share screen. Here we go.
Thank you.
There we go. Okay. Well, I was going to talk a little bit about kind of where we're at right now, because this year was our first year to do what's called the Community Eligibility Provision Program. It's a special program that Texas Department of Agriculture allows school districts that qualify for it to participate in. So I have data from September through last month that I can share. Let's see. So just to give you an idea, the difference between what we did last school year and this school year. So last school year, not all students received free meals. They had to qualify based on the meal application, so they could qualify free, reduced, or paid according to what their eligibility was, or they are in a state program and could qualify categorically eligible. And then there's just a list of all those programs that are the state programs. This year, Because of CEP, all students were able to receive a breakfast and lunch at no cost, and we did not have to require the meal application, although we did require the socioeconomic form to gather that data for PEIMS. Then here's just a snapshot of what our increase in meals are compared to last year to this year. So we did increase our participation because of the free breakfast and lunch. You can see the free breakfast on average, about 35% more kiddos ate free breakfast. And the high school in stars is the highest. And then Bronner, of course, they had a lot more kiddos enrolled there this year. So they had a lot of students eating with us. And then at lunch, it went up about 19%. Then we're still looking at data for this year to be able to determine if we can continue CEP for next school year. So we're going to wait until that data comes in the end of May, and then we will reevaluate and make that decision and let everyone know. Anyone have any questions? No? All right. Thank you all.
Thank you. Super exciting. Thanks for sharing that, Amy. The next item on the agenda is talking about how we can best get more parent involvement when it comes to letting their kids join the presentations that have been approved through the Brazos Pregnancy Crisis Center and the Children's Advocacy Center. They sent home a letter, a permission slip 2 weeks before, stating all of the information that the presentations are coming. They're very informative, what they're about, some highlights of it. Also has the link of both of the presentations on our website, on GISD website. But middle school and high school kids, as you all know, have a very hard time bringing those letters back to school, or even getting them out of their backpack to give them to their parents. So the counselors have asked if it would be possible to start sending home a Google form that would allow parents to just do it online, because people are much more willing to just do a Google form on their phone while they're at home scrolling through their phone or whatever. And so I told them that we would need to vote on that at SHAC to see if that's something that you all would approve of, and that we think that would be beneficial to get parents to do that. So I think the best way to do it and get everybody's vote recorded is if you will just put in the chat. I know I'm asking you to put a lot in the chat today, but I think it's the best way to get everybody's name for attendance purposes and also to count votes. But if you will put in the chat, I think we need parent permissions for things like I said, the BAC and the CAC videos. Also, fifth grade, most of the fifth graders, their videos, I mean, their permission slips come back. They're a lot better in elementary school, but they also show the puberty videos that have been approved. But we also have to get parent permission on those. So we would use it for all of those videos that we have to get parent permission forms filled out. We would use that Google form to make it a little more simplified. So if you will vote in the chat, yes or no. Yes, meaning that you approve to use a Google form. No, meaning you do not approve to use a Google form. And so that would be very helpful. Just give y'all a minute. Perfect. Okay, thank you for voting on that. The next thing and the last item on the agenda is to discuss, again, we did this last year, and for those of you who are new, I'll explain why we're visiting this again. We are looking at voting on and seeing what you all think about moving the SHAC meetings to because we are a school of District of Innovation, we can move our SHAC meetings to the DAC, which is the district. Oh, you know what? I'm just going to read it because it'll be easier for you all to understand if you don't understand it. Okay. So SHAC is a group of individuals selected to advise the district on coordinated school health programming and its impact of student health and learning. SHAC provides an efficient, effective structure of creating and implementing age-appropriate sequential health education programs and early intervention and prevention strategies that can easily be supported by local families and community stakeholders. When the health TEKS recently changed, we met and reviewed all the new presentations and curriculum. The board approved all of the new health education programs, which we will use for the next 10 years until we have a new adoption cycle. We are not changing our program yet. We're proposing to opt out of SHAC meetings and proposing to move these SHAC meetings to a district advisory council, the DAC, that also meets 4 times a year. This would consolidate the number of meetings and the number of committees required by law and will better serve this community. The DAC will convene at least 3 to 4 times a year to address needs as well as their needs as well as any other needs. So if we had anything from SHAC that needed to be discussed or approved, we would take it into the DAC. And we could also have some of the members that are on SHAC that wanted to continue serve on the DAC meetings. House Bill 1525, which passed during the 87th legislative session, did not change the applicability of Texas Education Code 28.004 in reference to charter schools or districts of innovation that have opted out of this section and have not listed having SHAC in other DOI plans. Therefore, the changes made by the House bill do not apply to such school systems. The Texas Education Code 28.004, which discuss local SHACs, do not pertain to public charter schools. Thus, it would not be required of a district of innovation. This would ultimately be a decision that the board would make, but we are proposing to opt out of SHAC and moving them to the DAC committee. So if we could vote on that, another reason before we go into that, we have had good participation this year in our SHAC doing it online, much better than last year. Online we've had averaged around 15 to 17 people on our meetings. But I do know that the content that we share, sometimes it's repetitive and there's not a lot of new content since we've basically already voted on the health TEKS that won't change for 10 years. And the small things that come that are necessary, example today, voting on the Google Forms for parent permissions, those could be taken care of at the DAC meeting. So we're not doing away with any of the content or anything that is necessary for parent or community approval. We're just basically seeing if it would be easier on everyone to move it to a meeting that already is happening. So there's that. So if you guys will do the same thing and in the chat, so that there's a difference, let's vote on keeping it or opting in or opting out. So if you will put in the chat, let's just do move or keep. And if you say move, then I will know that you're willing to move it to DAC. If you want to keep it, we'll keep it as is. So if we can also get that vote in the chat. Just wanting to make sure that I'm reporting everybody's votes before we end our meeting because I do not want to lose your votes. And to answer one of the questions in the chat, yes, we can keep parents on the DAC. Okay. All right. Are there any questions or anything anybody would like to discuss? Because that is all we have on our agenda and all that we had to discuss for this SHAC meeting.
Can I, just because this is my first ever SHAC meeting, you know, I had to do the approval since Tracy was the representative for the CAC initially. And so
Right.
I just wanted to introduce myself to anyone
Yes.
who may not know. My name is Ashton Martinez, and I am the Director of Education and Engagement at the Children's Advocacy Center, Biloxi River Children's Advocacy Center. I just wanted to say hello and say I'm glad to be here. And yeah, that's all.
Well, we are glad you're here. Welcome to the meeting, and we're thankful for all that you all do for our district and all our
Yes,
schools. So
of
thank you.
course. Thank you.
Anything else? Anybody have anything? Nope. Okay.